Marin County Superintendent of Schools, and I'm the person that is going to help moderate this panel this evening. The purpose of our gathering, I'd like everyone to take a note, so hopefully nobody moved their chairs, because these chairs, today a notice came out, no gatherings over 100, stay appropriately away from each other, and so we essentially pushed out significantly to everyone to ask as many people as possible that they would take advantage of the opportunity to connect through our Facebook streaming, right? So we've got Facebook, we're here, so we have other people that are joining us. So thank you very much for being here. Here's the goal of this evening is that whatever questions you have, that most of them will get answered, that you will leave feeling more informed, better prepared as we deal with this important issue in our world, right? I had a chance just a few hours ago to be in a meeting with the governor, state superintendent, and Dr. Angel, who's the head health doctor for our state. And in listening to what was going on, I was able to hear quite a bit from colleagues across the state about the lack of communication, collaboration, consultation with local doctors, public health. And I was able to say, excuse me, let me tell you what it's like in Marin County, and not just because of this particular virus, that whenever we face an issue that is related to health, we are working with Kaiser Permanente, with our public health partners, and I want you to know I feel so lucky that we have, that Matt Willis and Pat Kendall are both on my speed dial, and they can affirm that they speak with me very, very, very frequently. Let me describe the way this is going to go this evening. That we are going to have the opportunity to hear from these experts. So that's one. There was a piece of paper and a pencil on your chair. If you do have a question that you would like asked, if you could write it there, team members will be collecting those, and we'll be asking those questions. We also have already had submitted multiple questions on multiple topics, so we also have those that we'll be able to get asked and answered, and the people that are involved in the Facebook streaming will have the opportunity to ask questions as well. So, having said that, I want to say that I appreciate the panel members. Thank you so much for being here, and I'm going to move right into introducing them. First of all, we have Dr. Matt Willis. You might think that Matt is the one in the middle, and if you do, he is. He's our Marin County Public Health Officer since 2012, worked for the United States Public Health Service and Center for Disease Control, medical doctorate from Temple University, master's in public health from Harvard. His second in command, Dr. Lisa Santora. So Lisa, if you'd just raise your hand for a second. Deputy Public Health Officer since 2015, former Chief Medical Officer at Beach Cities Health District for 7 years, doctorate from New Jersey, master's in public health from State University of New York at Buffalo. Next, we have Dr. Shilpa Marva, infectious disease from Kaiser Permanente. And I just want to note that we're trying to give you the whole spectrum, right? The infectious disease side, along with our public health perspective. Dr. Shilpa grew up in India after attending Calcutta National Medical College, came to the United States for her residency. We're so happy you did, and fellowship in Washington, D.C. Started in private practice and joined Kaiser Permanente, and is a strong advocate for the integrated healthcare model. Also, we have Pat Kendall here. Pat, if you would just raise your hand for a second, who is the Kaiser Medical Group Administrator. So thank you very much. It's great to have you here. So with that, we are going to go ahead and begin, and we're going to start with opening remarks from each of you before we move into questions. One other thing for you to be aware of, this is a hard stop, and when I say hard stop, I mean stop. You will be walking out the door at 7:30, so this is not going to be an all-night affair for sure. And Matt, are we going to start with you?
We're going to start with Dr. Mao.
Oh, very good. Okay.
So I actually have slides. Do you want me to draw?
Are you going to do that for him?
Okay. Good evening, everyone, and thank you for being here. I'm Dr. Shilpa Marva, Chief of Infectious Diseases at Kaiser Permanente San Rafael Medical Center. Before I start talking to you as the clinical infectious disease expert, I want to take a moment and sort of acknowledge the anxiety that surrounds COVID-19. The anxiety that you feel as parents, caregivers, and community members. I say this as someone who has 2 children who go to Marin County Public Schools. I live in the community, so I get it. And that's why I'm here with my public health colleagues to talk to you tonight. So coronaviruses are not something that are new. They have been around for a long time. They are a family of, great, thank you. They are a family of viruses that typically cause the common cold. However, on occasion, they can cause serious diseases, including pneumonia, and can result in hospitalization and even death. Examples of prior coronaviruses that have caused severe disease and required enhanced infection control measures include the viruses that caused SARS and the virus that caused MERS. So what is COVID-19? It is a disease caused by a novel coronavirus first identified in 2019. And novel simply means a virus that has not been seen before. COVID-19 is the name of the disease. It's important to remember that sometimes viruses and diseases have different names. For example, rubeola is the name of the virus that causes measles. So the virus that causes COVID-19 is a virus called SARS-CoV-2. The key symptoms of COVID-19 are similar to any other respiratory tract infection, flu-like symptoms. So you can have a fever, cough, shortness of breath. But it's important to remember that up to 80% of cases will have mild to moderate illness. And it's only the small minority of patients who have other chronic cardiac and pulmonary, heart and lung issues, which can cause, who can get severe disease. It's important to keep that in mind. We know that illness in children tends to be mild. We know that children recover, sometimes without many symptoms. But the reason it's important is because they can transmit the infection to older people in the community. Which brings me to the question of how does transmission occur, or how does this infection spread? The virus is thought to spread mainly from person to person, between people who are in close contact with one another, and we use the 6 feet distance to refer to close contact. It is spread through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby and can possibly be inhaled into the lungs. The question of whether it can be spread from infected surfaces or objects comes up often. It is possible that a person can get COVID-19 by touching a surface or an object that has the virus on it. However, this is not thought to be the main way in which the virus spreads. I often get this question as an infectious disease doctor. Well, how long does the virus live on the surface? And as an infectious disease doctor, the question that I really want to answer is, regardless of how long the virus lives on the surface, is it capable of transmitting infection? Because that's really what we want to know. And fomite transmission, which means transmission from objects or surfaces, does not appear to be a major mode of transmission. This virus can be cleaned with regular disinfectants, including bleach, so that's important to keep in mind as well. Currently, there is no vaccine or drug available for COVID-19. People with COVID-19 should receive supportive care to help relieve their symptoms. And people who think they may have been exposed to COVID-19 should contact their healthcare provider immediately. So what can you do to protect yourself and to protect others and to keep your family safe? Well, this goes back to basic common sense precautions that we infectious disease doctors like to recommend. Avoid close contact with people who are sick. Use either an alcohol gel or wash your hands with soap and water, often for 20 seconds. I have my kids sing the happy birthday song when they wash their hands. Stay home if you are sick. Do not go into work. That is your obligation as a good member of society. Avoid touching your eyes, nose, or mouth with unwashed hands. Cover your mouth and nose when you cough or sneeze, and throw away the tissue and wash your hands. So the bottom line is wash your hands. You can't do it often enough. You can clean and disinfect objects and surfaces you touch. You can use regular wipes. Bleach wipes are great. But really, if you were to focus on one message tonight, it would be wash your hands. The infectious disease doctor is telling you to do that. I want to take a minute and address this question about whether to wear masks. I recommend following CDC guidance, which recommends no face masks for people who are well. Face masks should be reserved for people who have respiratory symptoms, and you are doing that to prevent spread to other people. And face masks should be reserved for healthcare workers who are providing care and taking care of patients with COVID-19. And I'm going to end with this last slide, which my wonderful health education team, put together for me. This is something that I remind myself. How do you take care of yourself before you can take care of others? It is okay to take a break from listening to the 24/7 news cycle. It is fine to limit excessive exposure to news and social media. It is also important to know facts from myth. The CDC is a great resource, and last but not the least, it's important to take care of both your physical health, so the usual, sleep, get enough sleep, exercise, focus on diet, and take care of your mental health by connecting with others. If you are having anxiety, go find a trusted loved one. Go find somebody you can share this anxiety with. And I think that's really what I'm going to end with. Take care of yourself, take care of your family. This is not something that we need to be afraid of. Thank you.
So thank you very much. I just wanted to let everyone here know that as of this moment, we have over 850 people that are watching this through the Facebook live streaming. So exactly what we wanted to see happen. So.
Thank you, Mary Jane. I wasn't feeling too nervous till I heard that. I'm Matt Willis, the Public Health Officer for Marin County. I want to thank Mary Jane Burke and the Office of Education for hosting this. When this was suggested 2 weeks ago, we had a sense that, we were going to need a forum for clear communication and balanced guidance as we navigate this. I think even then we didn't recognize how important that would be. And as a sign of how rapidly the situation is changing, earlier today, this is going to be a large community gathering with potentially hundreds of people on site, and we issued a recommendation this afternoon as part of the evolving response to this epidemic. Sorry, I'm going to step away for a second. Is that better? Okay, great. As part of our evolving response to this epidemic, we made a decision to, in Marin County, limit gatherings of individuals of 100 people or more indoors indefinitely, starting with at 2-week segments. But this is something that will likely be something that will be part of our response as a community for the next several months. So this is an example of how adaptive we can be as a community, that we're able to get the word out, and how many people are participating in what is one of the more healthier ways of participating now in the age of COVID-19, which is remotely. So greetings to everyone. Is that where the camera? There's the, okay, great. As Public Health Officer, I wanted a chance to offer you an update in terms of our status as a county and some of the most important strategies that we're taking to react to this epidemic and prepare for the future. And also wanted a chance for us to run a few scenarios that we're hearing from the community. We've established a warm line and a hotline for people to call in, and other ways for people to actually reach out with questions. And we've used that to assemble what we think are some of the most common concerns that are coming from our community, and we'll offer answers to those questions with Dr. Lisa Santora. Dr. Marwell covered many of the important points that around the epidemic itself. There's a picture of the virus, that's the capsule, and all of those, the knobs on the virus are what actually allows it to attach to cells in the lung. So it's This is the global state of the epidemic currently. There's over 100,000 cases across the world. Obviously, the vast majority of cases still remain concentrated around China and Asia, where the virus originated in December of 2019. But every continent except Antarctica has had cases, and it's in over 50 countries nationally. So this is a pandemic. One important consideration with that term is that pandemic doesn't necessarily mean that it's severe disease. It just reflects the global nature of it. And if the World Health Organization hasn't offered it that designation with a capital P, functionally this is a disease that's spreading across the globe. And we are not surprised to find increased evidence of local transmission here, as is being seen elsewhere. I wanted to share with you just one of the basic concepts of epidemiology that we think about as public health practitioners. This is called an epidemic curve. This is not for COVID-19. This is for any disease, essentially, where we see an increase in incidence of an infectious disease, an increase in incidence in the community, and then a decrease over time. This is what we will expect to find with COVID-19 in our community. Our goal in public health and all the community interventions we engage in together is to limit the height of that curve, which is the number of cases we have, and limit the duration of time, right? So all the work we're doing is to try and sort of attenuate what we expect is the epidemic curve of the experience that we're seeing. I wanted to also, so the good news there is that we will endure this, and this epidemic will resolve as others do. Another important consideration, I think, just to keep in the back of our minds as we think about COVID-19 is the comparison to influenza. And I know others have made this comparison, but it's really important because as public health officials, I'm out there, with Dr. Santora and Dr. Marwa and others every year, in August, beating the pulpit about influenza season is coming, it's time to get vaccinated. It can be a deadly disease, it takes lives every year, and there's steps we can take to prevent it. And it sort of feels like a public service announcement, and there's sort of semi-interested response, and a lot of people, even about half of the people, choose not to get vaccinated against influenza. But if we actually look at what the burden of influenza is in our communities, it's important to keep that in mind as we look at the burden of COVID-19. So this is the data that shows the experience of influenza every year in the United States. And it's seasonal. So this shows from probably October through March of each of those years, 14, 15, 15, 16, et cetera. And the height of the pyramid is the number of individuals who are presumed to be infected. The very tip of that pyramid, the tip of the iceberg, is the number of people who die in the United States from influenza each of those years. And if you just look across those years, 42,000, 12,000, 43,000, 36,000, the last there is 56-something thousand. Yeah, sorry, I can't see without my glasses. So the point is that there's tens of thousands of deaths, predictably, every year for influenza. And we're seeing, we've seen one death from COVID-19 in the state of California. And there's obviously a lot of concern and even panic in certain situations around COVID-19. And let's not forget that the devil we know is actually, in very measurable ways and appreciable ways, a much higher burden and a much higher lethality for us. So one of our messages all along with COVID-19 response was to get your flu shot, because it's still a higher risk for us. Another important point in our general understanding of this disease is emerging from countries that have had more recent experience than in China. So the first data we got around this was China. And in China, we were seeing, those who were tested were those who were sick enough to get tested, and many of them were hospitalized. And the mortality rate in that setting was about 2%. So about 2% of people who were infected in China, of the tens of thousands, died. When we see what happened in other countries, like Germany has had 1,200 cases, 2 deaths total, right? So, South Korea, over 7,000 cases, 53 deaths. So the mortality rate in places that are more like our community is less than 1%, and it is similar to the mortality rate we experience for influenza. The influenza mortality rate is about 0.1%. I'm not sharing this to dismiss the need for a robust response to COVID-19. I'm offering this to help temper and balance our collective response. There's an analogy I'd like to make here, which is when viruses cause disease, whether it's influenza or COVID-19, it's usually inhaled into it's in the lung tissue where you have the main pathology is a pneumonia. And when people pass, it's usually from respiratory compromise from a pneumonia if they pass away. That's actually not from the virus itself. It's from the inflammation and irritation and the body's response to that virus. There's an analogy here to our social response, which is COVID-19 is what it is. Our response collectively as a community is something else. And our social inflammation and irritation and response to this could actually be more harmful than the disease itself. And I'm not saying we're doing that, and we are working very strong to take very aggressive public health measures on this, but I think we also need to be vigilant about making sure that we're not fueling an inflammatory response collectively that might actually contribute to harm rather than well-being. So this is our status as a community. We've had 15 cases total in Marin. Scratch that. 15 tested total in Marin County, 1 case. 11 current persons under investigation. So persons under investigation is the CDC classification for people who are determined to be at risk, at sufficient risk for disease that we are able to test them. That classification is changing. The criteria for that classification is changing rapidly. We've had 4 cases who tested negative. 3 individuals have been hospitalized. We've had 1 confirmed case. We've only had 1 confirmed case in Marin County that was announced this morning, someone who was diagnosed over the weekend. And that individual was on the Grand Princess cruise ship that traveled from San Francisco to Mexico and back, coming back on the 21st of February. And so we knew where that person was actually infected. And the individuals who were in close contact with that person have been identified, have been isolated, and are also being tested. There are 10 individuals awaiting lab results, and we are monitoring return travel. Another important aspect of our response is when people return from areas of the country or areas of the world that have been deemed high prevalence areas, the CDC notifies the local health department, and we actually reach out to those individuals to monitor them at home for an interval of 14 days, which is the incubation period of COVID-19. If individuals remain asymptomatic, in other words, if they don't get sick within that 14-day interval, we assume that they're out of the woods and they can return to their normal life and return to work and return to school. But until then, we want to make sure that they've been isolated from the community at large. Another important update for today, and this is emerging so quickly that I think this is a wonderful forum for us to offer some of the messaging of the day, is there is increased capacity for testing now. As of today, some of the private laboratories are able to do testing. And so one of the constraints we've had up until this point was we had to apply a much more stringent criteria for anyone who would be tested based on an established risk of a history of having traveled to an area with known exposure and symptoms, or someone who was sick enough to require hospitalization where there was no alternative diagnosis for a respiratory illness. That criteria has now expanded more broadly, and the clinicians in our community are given more leeway in terms of using their own subjective clinical decision-making to determine whether or not someone should be tested. We are still working with our clinicians to encourage people to be judicious in their decision-making about who should or should not be tested. Not everyone with a respiratory illness should be tested for COVID-19. The disease remains rare in our community, and we want to make sure that if clinicians are testing for COVID-19, that they understand the implications of the results of that test. Because if the test comes back, first of all, as soon as the decision to test is made, that person is by definition defined as someone who may have the disease and needs to be separated from others for an interval, right? That's consistent with the decision to test. So they would be socially isolated for a period of time until the results come back. If those results are positive, that person is quarantined at home for an interval of 2 weeks. So it is not a trivial decision to test. And so we're working with our clinicians to make sure that we're navigating these decisions that are newly available to us starting today in terms of who to test and who not to. Another important question that's come up today relates to the Grand Princess Cruise Ship 2. So we had, as most may know, on the Grand Princess Cruise Ship had 2 legs to its journey. It went to Mexico and came back, and then it went to Hawaii and came back. We had 55 Marin County residents on the first cruise ship that went to Mexico. We followed all of them through their interval of incubation. 3 of them ended up being, some that we were following. 1 of them ended up being a case. We're waiting on the results of the other 2 that we tested. But we don't know yet how many Marin County residents were on Grand Princess 2. Among those 2,500 individuals who went to Hawaii and came back, who are now being quarantined at Travis Air Force Base, some number of them will be Marin County residents. We have not been told by the CDC who they are, and we are waiting eagerly for that manifesto so that we can prepare to take them home, which I'm sure they're eager to come home. So this is just a headline, just reminding us, of what happened earlier this year. 2 Marin County residents passed from influenza. I want to go through some of the criteria regarding travel. In fact, why don't we do that through the scenarios? It might be easier to do that, the travel question through the scenario descriptions. And I'm eager, I know you all want to have questions, so we can open it up soon for questions and answers. These are our common travel-related questions, and I'm going to hand the microphone over to Dr. Lisa Santora, Deputy Health Officer, to march us through some of these common travel-related questions, and then we'll open it up for broad question and answer. Thank you.
Make sure I got the cheat sheet. Thank you, everyone. We have been working hard to answer a lot of the phone calls that we've been receiving from schools and the community, and this is what has formed the selection just of these questions, although we'll have opportunity for, I'm sure there's more questions that are out there, and we have a whole list of questions there. But again, just like Dr. Marva, I'm also a mom of 2 kids in our Marin County Public Schools, and we all are working in this community and living in this community, and we're with you, and we are really trying to make the best decisions, both to balance the risks of socially isolating people with the benefits of slowing down the spread of the disease. And so we really are trying to have a very measured response, and I think we all have a vested interest in protecting all of us in our community, and especially our most vulnerable, who we're seeing now are those over 65. More evidence we see is that fortunately children aren't as affected by this disease, unlike the flu. The flu often is known to affect that 65 plus and then the under 5 population very significantly. We're really seeing across the globe very mild cases of coronavirus or COVID-19 in children, and very, very low attack rates or death rates in children, which for us and for me is very reassuring as we are trying to make, again, these decisions to inform whether parents should stay home or whether children should stay home. So we just go through these from bullet by bullet, and again, we'll pause and then start with the questions that are out there at large. So a parent has returned from China or Iran. This would have been considered on that orange list that it would be a medium risk exposure, not our highest risk exposure. Our highest risk exposures were considered those who are returning specifically from Wuhan City in Hubei province. The upside of all this is people are learning their geography again. We've learned a lot more about the provinces, and we always can improve on geography. We're learning every day. And is it okay for kids to go to school? The answer is yes. The parents would be and this is where your public health nurses are hard at work, would be advised to self-quarantine for 14 days. As a mom, I know how hard it is to socially distance from my children, especially during flu season when they are amazing cuddlers. But we would still allow the kids to go to school and monitor that parent and to make sure that they're asymptomatic. And the parent becomes asymptomatic, we would be having one-on-one conversations. This is where we don't just have these systems in place. We really do have one-on-one conversations to determine if there is that ability of the parents to still limiting contact with your children sounds oxymoronic, but to be able to socially distance sufficiently and engage in proper hygiene, because again, it really is hygiene, to make sure that everything is safe. And so in this case, it would be okay for kids to go to school. The new one that came out for us was very challenging was the Italy, where we had received much more notice that we received the list of people who are returning from China, and then we were receiving the list of the people that were returning from Japan and then South Korea. We never received lists or manifests from the planes of people that were returning from Italy. So we were dependent on the arriving travelers receiving educational materials from the Centers for Disease Control at the airports where they were screened and advising them to self-quarantine. There's some confusion around that, and it happened at the firsthand with China was when there's a decision around, that's actually a decision, a social distancing decision that is not necessarily going to be made when the first cases are seen in Italy. So the burden of disease has been increasing every day, like you were about to see happen in the Bay Area. And there's the day that is selected when the CDC then makes the recommendation to self-quarantine. So there are people that returned from Italy when we first heard of some cases in Italy that weren't provided that recommendation. And that makes it challenging. It's harder for the community to understand. It makes more rumors coming back, especially after winter breaks and people were traveling, and then the guidance shifts. So that's something why we do have a call center to really help the community have the ability to talk to a public health nurse or one of our medical reserve volunteers. We're so fortunate in Marin that we have a group of public health nurses, doctors who are volunteering through the Marin Medical Reserve Corps to support our ability to reach out into the community, both by providing additional training and also answering those phone calls. So that's why I think a lot of the Italy conversations became very confusing, because the recommendation from to self-quarantine didn't come until a few days until after we had our winter break end. So yes, it's still okay for those kids to go to school. I was told I was exposed to COVID-19 on a cruise event with a close contact. That's when we get involved in a pretty heavier way. So that is our strongest definition of why you should be a person under investigation, is because you have been exposed to a laboratory confirmed case of COVID-19. That's going to evolve as this disease increases in prevalence in our community, and our criteria is going to change. But we would, this group of travelers were the ones that we, for example, the Grand Princess travelers, we received the manifest of those individuals. That was we did not receive the manifest of those individuals until the beginning of March. So there was a time frame where people were circulating in the community, but we then went through and contacted all of the individuals on that manifest to confirm that they were asymptomatic, and that we are now actively testing individuals who presented as symptomatic from this return of this event. So you would.
Excuse me, could you speak a little slower? We're
Okay.
missing a lot because of the acoustics.
Okay, I'm sorry. I'm from Jersey. It's a little hard. I'll try. So that would be our classic scenario of the Grand Princess traveler. It's a confirmed contact with a COVID-19 case. You would be identified and placed under self-quarantine and not tested right away, but to monitor for symptoms. And then if you develop symptoms, then to recommend testing. I was at an event with someone from a country with community spread. Am I at risk? We would say no. We have a good definition of close contact. We, of course, provide consultation if necessary, but being at an event is not an indication for your risk. Again, we are looking for people who are symptomatic, just like with flu. People who are symptomatic and coughing and sneezing and producing droplets are the ones that are infectious to us. So we would not recommend testing for this individual. And then the last one, the kids went to France. Am I okay to go to school? As of today, March 9th at 7, or almost 7 o'clock, yes, it's okay for them to go to school. We follow very closely with Centers for Disease Control guidance. And so we are regularly looking up to see what are the countries that are now identified as a level 3, where there is now recommending people that return from level 3 countries engage in that self-quarantine. So that will be, I anticipate that will be changing as well. And we'll also see potentially California identified as a place as we start seeing this disease spread in our community. So,
There's one more on this slide.
oh, I'm sorry, one more. Staff member came back from Italy, does not have symptoms, should she be at work? No. This would be someone that would be recommended to self-quarantine for the 14 days after their arrival. So, all right. So now we'll run through the other questions that you all have.
And let's go with the first question. Is COVID-19 a possible retrovirus? who would like to take that question? Do you mind?
So, coronaviruses are RNA viruses, and retroviruses are a subset of RNA viruses. I think this is not a yes or no answer. I would just say coronaviruses are RNA viruses.
Okay, great. If we close school, would we if we close school because there is an identified person that has identified positive, would that affect both the adults, i.e. teachers, and the students? If the answer is yes, why? And if no, why not?
So, the virus doesn't care if you're a grown-up or a child. And if you're in the school community, you are offering equal risk to the community, whether or not you're an adult or a child. So we view staff and students alike in terms of our response at the school level.
Okay, great. There's news that's telling us, and pressure that I'm even hearing at the state level, why aren't you just recommending that we just close all the schools right now for 14 days for protection?
Yeah, that's an important, that's come up a lot as, and regional health officers are having robust conversations about this particular question. Every intervention we take, we're trying to balance the harm versus the benefit in terms of potentially reducing spread and also the social harm of that intervention. We see school as essential gatherings, and there's very little evidence that community-wide school closures that are preemptive, so you're talking about preemptive school closures, right? Right. There's very little evidence that preemptive school closures are effective, especially in communities where there's limited transmission. Our current policy regarding school closures would be, if we have a case of COVID-19 in a school, we would close that school specifically for an interval of 14 days, which corresponds to the incubation period, and then reopen that school to those children who remained asymptomatic during that interval because they will have demonstrated that they have not been infected.
Beyond Marin, is there a risk of tourists coming from all over the world to Marin? Travel question.
Yes, we are an amazing destination. We benefit from tourism, and again, that's one of our other realities, and we want to, again, make decisions that don't adversely affect our community. Tourism is already going to be significantly affected. We're already seeing that in airports and other travel, and again, that's why we have another spring break ahead of us, and we'll be encouraging parents to make informed decisions and visiting the Centers for Disease Control about their travel plans, purchasing travel insurance if they are planning on traveling, and being prepared when they do return. The country that they left for, which wasn't a high-risk country, may transform into a high-risk country when they return.
Got it. Guidance for gym and health clubs, transmission in steam rooms and saunas.
I'll go back to my favorite answer, which is hand hygiene. Again, fomite transmission is not thought to be the major mode of spread. If you are 6 feet away from somebody, the droplet transmission is limited.
Yeah, and most of the health clubs, all of us, I hope, are sort of upping our game a little bit in terms of cleaning surfaces. It used to be just the sort of the OCD guy, next to you on the airplane who's wiping down the seat and the tray with the wipe. That's something we all need to be doing more of now. And the gyms and public transport and other sectors are doing a lot more of the routine disinfections they had been doing, just do it more frequently and more rigorously.
What about steam rooms and saunas? Anything particular about those?
I don't think there's anything particular about those. Obviously, they need to be also disinfected like other surfaces.
The question is more, if you operate a business that has those or an organization that has those, should they be shut down? There are large health and fitness facilities on the peninsula in the city now that are shutting their saunas and steam rooms. And my understanding is viruses don't survive well in high heat and humidity. I'm not quite sure whether they...
Yeah, so he's suggesting that they might just shut down. I think, that's an example of something that would be a preemptive and unnecessary step to take at this point. But, if we do experience much more widespread community spread, the CDC guidance for communities with wide community spread includes some of those more what feels sort of draconian measures at this point, and we would take that one step at a time.
Is it true that 80% of people with the virus are asymptomatic?
No, it's more true that 80% of people with the virus have maybe asymptomatic or have mild disease, like a cold that you get and it lasts for about 3 days. That's the more common picture of coronavirus, but not asymptomatic. But we are learning about there are asymptomatic carriers. We just don't know that data yet for the United States.
Can I offer that? So we had a wonderful, a glimpse into this issue of mild symptoms and asymptomatic with the Travis Air Force Base cohort. So up to that point, the only people that were getting tested were people who were sick enough to meet that stringent criteria of testing. When 180 people ended up being evacuated off of the Diamond Princess cruise ship, they were evacuated to Travis Air Force Base, and all of them were tested regardless of whether they're having symptoms. And that really offered one of the early glimpses of this issue of asymptomatic carriage of the virus. In fact, the patient that we received here into Marin County from Travis Air Force Base 2 weeks ago was very surprised that they were infected, felt perfectly well, and yet had evidence of virus in her nasal passages, and was not ill at any point in her course and has returned home.
Can I just add? I just want to add that that's precisely what makes this disease difficult to control. If all of the people who got the virus became super sick and required testing, it would be easy to figure out who has the disease. The reason why this is hard to control and requires so much public health intervention is because we have this large group who can have asymptomatic carriage or can have very mild symptoms.
Yeah, so this afternoon we made a decision to limit gatherings in Marin County to make a public health recommendation that gatherings of 100 people or more indoors be canceled or postponed. And that was based on the fact that we are seeing, a few factors. One was that we're seeing more evidence of community transmission outside of Marin County. So if you look in the South Bay, dramatic increase in cases just over the last 2 weeks. And we're seeing more and more evidence of community transmission. So I mentioned that our one case in Marin is someone who we knew exactly where that person was infected. It was on a cruise ship. Other counties are having experiences where people who are testing positive, they're not able to identify where that person was infected, and that person had not traveled outside of the county. So those are cases we're calling community transmission. And that's our first sign that the virus has established a foothold within the community and maybe it getting exchanged within that community. And while we haven't seen that exactly in Marin in terms of our cases, the fact that it's happening in San Francisco and in the South Bay, and where there was one example in Solano County, we recognize that the Bay Area is sort of a single human ecosystem. We have a lot of our employees who travel across our residents who travel across the bridge for employment and back and forth and and this concert that we are going to have on Wednesday night at the Civic Center would attract people from all over the Bay Area. So we really, the borders between the counties are artificial with regards to a virus. And so we made that decision partly looking at the prevalence elsewhere. And those steps are being taken in San Francisco, Contra Costa, Alameda, Bay Area wide in terms of limiting social gatherings. And the principle is obviously that when many people are gathered together in close proximity, if one individual is sick, those sitting closest to them have an opportunity to actually, might have exposure to droplets if that person is coughing or sneezing and themselves become infected.
What's the confidence level of the test results themselves, and do we have enough test kits in the U.S.? If so, how many?
I can take the first part.
Sure.
Yeah. So I'll answer the first part of the question. For any test, a PCR test, which this is, to be validated, the sensitivity and specificity needs to be over 90%. In this case, it is closer to 97%, so it's a very accurate test.
And are enough test kits available?
Right.
Yes.
Okay. Many friends have been told to work from home and have travel bans. Why are kids still being sent to school?
Again, I think that goes back that what we're seeing with this disease is it does not affect children, so we'd be more concerned about adults passing to children than children passing to adults, which would be in our influenza scenario. And again, we have to have the benefits of closing school, which is a major social disruption to our community, outweigh the risk of transmitting this disease. And we are having conversations every day with Bay Area health officers to look at science, really to be guiding this decision, which is a major decision in a policy.
Does the gathering of 100 persons in the same room mean that we shouldn't be having school assemblies?
So we see schools as, the language is actually non-essential gatherings, and we do see schools as essential gatherings. We can talk with the schools about individual school-level policies that they might adopt to make that environment even safer. Generally, the classroom experience is not more than 100 individuals at the classroom level. It is reasonable to actually suspend large gatherings within the school setting, if that's the normal part of the school day, to have large auditoriums where all the kids are gathered together. It is reasonable to reschedule those or find alternative ways for the community, the school community, to experience that.
By the time one student becomes symptomatic, wouldn't they have spread the disease for 14 days?
No, in most of the cases, we'll see people develop the symptoms between 3 to 5 days. 14 days is an outlier. We use that 14 days to be very protective when we're in the role of containment. That's when we're trying to slow or stop the spread of disease. So that is the role we play all the time in our communicable disease prevention and control unit, where it comes to tuberculosis and other infectious diseases, and which is why we are working and building up our capabilities to do the contact investigations, where we then go and interview the patients. We would have the closure of the school and then see where they're gathering, because we know with families there are kids at different schools, and that will be our decision-making of us learning from that positive case, be it a student, a staff, or a teacher, what other additional recommendations we need to make around closures related to our first case. And that's what we do every day with, like I said, with tuberculosis is probably the closest example, where if we identify a person in our community with tuberculosis, they're placed on a quarantine at home and isolated until we can prove that they aren't going to be infectious to the community, and then we go and investigate. We interview the families to see what other gatherings they are in. We are a connected community, so they may have been in a church group or some other events, and then we start, again, monitoring other individuals, and that is our basic bread and butter every day of the working year in communicable disease and prevention and control.
Can I just add to
Yes,
that?
please.
I think Dr. Santora highlighted beautifully the difference between clinical infectious diseases and public health. We all agree as clinicians that the incubation period is way shorter than 14 days, 3 to 5 days typically, but we like to be conservative, and that's why the 14-day guideline.
And there's one additional point is that individuals are far more infectious to others when they are symptomatic. The virus engineers its response. It loves to cause coughing and sneezing because that's a very effective way to transmit itself and reproduce itself in a community. So the symptoms that it causes are partially designed for spread. So people who have asymptomatic carriage are much less infectious to those around them because they're not coughing and sneezing.
If my daughter's school closes, and I don't think, because she's been, someone has been identified with the coronavirus, but I don't think she's ill, would it be okay for her to go to a different school?
No. This is one of our easier questions of the night. So that child has been in that environment. There's no rapid test that day to say that they've been infected or not infected. We don't have that technology yet. Maybe one day we will, and that's why we would take those conservative measures of recommending a home self-quarantine of that child until we can test, until we can confirm.
Okay. Is there a plan to clean all the schools within the next 15 to 30 days? what will the Marin County Office of Education do to clean schools in the county? So the answer is yes, all the school districts are on high alert, employing additional cleaning strategies and doing some deep cleaning, and the Marin County Office of Education will be cleaning the schools that we operate, but not those that the district operates. My doctor said they couldn't test me because they didn't have the right equipment. Is this true? Is it a special test to collect?
Yes, at this time, it is a special test to collect. We require, I'm going to get a little sciencey, contact, droplet, and airborne precautions. So that means that we need to have trained healthcare professionals who know how to appropriately don and doff, put on or take off personal protective equipment at this point in the disease. We anticipate that this will shift. We don't know when, where it would be recognized that it just requires droplet precautions, which would be similar to our testing for influenza, but we're not there yet. And so that's one of our concerns with the wide-scale testing, which is a positive in our community. We want to also be able to ensure that those who are collecting those specimens, which is invasive, you're getting close and taking a swab from someone's nose and their mouth and throat, that they have been trained properly, because if that person does test positive, then they become immediately once they are tested, they become a person under investigation and have to be in self-quarantine. And then if they do test positive, the machine I described before, our public health department will then call and contact and try and identify all the places this person who tested positive has been, and then also have to confirm that when the test was collected, that the healthcare worker used the appropriate personal protective equipment. And so that's why we want to make sure, as the laboratory testing is available, that's wonderful. We need to make sure that we're protecting our healthcare providers and that they are ready to actually collect the specimens in a way that follows CDC guidelines.
For people 65 and over, the question is, should we stay home? And I'm one of the we. So we've been hearing more and more direction about if you're older, you should, quote, stay home.
Do you want to say something about that?
Say no.
I won't add anything different to what's already been said, right? So yes, you want to avoid a large gathering. Yes, you want to wash your hands and wear a mask if you are sick. But other than that, I don't think you need any special precautions just because you happen to fall into that age category.
Yeah, that's one of my biggest concerns, I think, about offering a recommendation that we cancel certain gatherings and that we offer furthermore. I think we've been really clear in communicating the particular risk for people who are older or have weakened immune systems is that we know that social isolation is also a major barrier to health, especially for our older population. And so we don't take those recommendations lightly, and certainly don't want people to exaggerate their risk. There are many, obviously, healthy things we should be doing in our everyday life, and we should continue to do those things, getting outside, gathering with small groups of friends, and being with your grandkids, all the stuff that people do to make life meaningful and happy, I think those things are still protected in this. We're really being as specific as we can about certain settings where the risk probably exceeds the benefit.
Okay. Is it safe to go to medical facilities and typical medical appointments?
Yes. We are encouraging, and all of our healthcare providers are exploring expanded telehealth use. We want to make sure that people who are sick, if they do have access to telehealth or telemedicine, that's a tremendous benefit. And we can make sure we are decreasing possible exposures of people who are sniffling, coughing, and sneezing in our healthcare environment. And again, so we have those options. And we don't want people to avoid seeing their doctors or avoid care. That's been one of the concerns that we have seen is people are starting to cancel their doctor's appointments. Our healthcare providers in Marin County have been working hard to ensure that their facilities stay clean and safe and their staff are trained in infection control procedures so we can continue to provide the services, those daily services that people need to take care of their chronic diseases. So we are working closely to increase that capability across the community to provide telehealth services, which may be a great option for an individual who is not sick enough to go to the emergency room, but just needs to have a telephone or a televideo visit with their doctor. And then our healthcare facilities are also preparing themselves. They identify people who are presenting with symptoms and provide them with that surgical mask. That's what, going back to Dr. Marva's red line about the mask, we want to preserve those resources so when our healthcare facilities are receiving people who may be sick, that they have the masks available for those people who are symptomatic, and that we're not using up all the masks, because the masks are just, it's for us if we're sick and coughing and preventing that spread. You've all seen probably the big picture where the sneeze projects 6 feet away. That's why you would wear the mask, because you're sick. It's not for you to be prevented from getting sick. And we have to preserve those resources, because we are ramping up our ability and need to make sure at this point, both while testing is expanding, we still have limited personal protective equipment resources that we have to protect for our healthcare workers.
Is it true that Marin County is soon to have drive-by testing?
Yes. Yeah, I mean, but it's important that, that is not a public invitation to come to In-N-Out Burger. I mean, we are with our health, we recognize that the increased capacity to test and the public recognition that there's an epidemic and the people who may have symptoms are concerned about their own status will lead to demand for testing. We also want to protect, as Lisa said, our healthcare settings from having people coming into those settings for that testing. So the answer to that is working with our clinicians on a referral basis for individuals that they determine in their own decision-making, in concert with public health, to send them to a location that we have yet to designate for testing, where we're able to do that. And this is an evidence-based strategy to actually do testing where people are in their vehicles, who are otherwise well enough that don't need to be hospitalized and don't need a more thorough clinical evaluation but do need a test. It's probably the most effective way that we could make sure that testing occurs in the volumes that we expect, while not exposing healthcare workers and other patients who might be in a waiting room.
Okay, do hospitals have limited access to tests at this time?
Well, I can speak for myself. The answer is no. We have been working very closely with public health, and now with commercial labs also offering testing, we have the capability. I have not had a problem getting a test for my patients that I have been taking care of.
Mary Jane, can I say something about, I think there's something important to know about testing. There's been a lot of, so this sort of scarcity of testing has been clear, and our national response, we just early in the last few weeks haven't had enough tests, and that's led to a lot of public information about the scarcity of testing, which in itself sort of drives demand for testing. We need to be clear on what the results of testing is. COVID-19 is generally a mild illness for the vast majority of people who experience it, for which there is no treatment, right? So a test result will rarely affect the clinical course, because there's no treatment. What it will affect is our ability to identify you as someone who requires to be isolated from others, and potentially quarantined in your home for 14 days. And so that's, it's important that when people are feeling as though they need to be tested, they're recognizing that it's not necessarily for the sake of their treatment, again, because it's a mild respiratory illness, much like flu or cold in most cases. And the doctor's not going to prescribe something different to you based on the results of that test. And those are the conversations we're having with our clinicians in terms of helping patients navigate the decisions who may be seeking testing.
I'm just going to add that's such a great point, because as a clinician, I need to take into account how likely somebody is to have the disease before I consider testing them for any disease. This is not just specific to COVID-19. And those are sort of the decisions and clinical decision making that we do every day, regardless of whether it's COVID-19 or any other illness.
Okay, great. Could you please describe when it is that you would recommend closing a school, just so we can have... And the reason I'm asking this is that we rely on public health meaning that they assist us in terms of what decisions will be made. In the event that there was a situation that there would be a recommendation for you all to know, the team at the school, combined with our public health partner, combined with someone from our office, would be sitting down and talking through the nuances, right, of the situation. But there is actually a precise situation that you would know that school would be closed for 14 days since the date of the last exposure.
Yeah, we would recommend closing a school if there was a laboratory-confirmed case on campus. And there's a variety of scenarios that might lead to that. The first, anyone who's laboratory confirmed as a case starts as a person under investigation. So there's a clinical suspicion that person may have COVID-19. That's often due to an exposure history. So the scenario might be someone is exposed to someone who is returning on a cruise ship. So my grandfather was on the cruise ship. I was living with him. I'm not having any symptoms. Turns out I was in school before we realized that he was infected. And now that child develops symptoms. We would, obviously, as soon as we knew that that child had that exposure, we would pull them out of the school, regardless of whether or not they're having symptoms, and then test that child. If that test comes back positive, we would then recognize that child may have exposed others at that school during an interval prior to determining that they had disease, and that would be the criteria for closing the school, because we would assume that others at that school may have been exposed. And the only way to make sure that it doesn't transmit within that school community, in that case, is actually to close the school for an interval of 14 days and have those children at home. Some of those kids who may have been exposed may actually develop illness themselves, right? But they will do that in a setting where they've been isolated, rather than in a setting where they're together. And that's the rationale for closing. It limits the proportion of children who become infected if there's an infected child on campus. After 2 weeks, the school has been totally disinfected. The school itself, as a facility, there's no risk. So the school's been totally disinfected. Those kids who are well at 2 weeks are out of the woods. They're back, and that's how we presume we would have interrupted the potential spread through that closure. Does that make sense?
Yeah, right. So if there's someone infected, right, schools will be closed. Let me just say, short answer. There might be a school closure. So I would want people to, if you haven't received this card on the in or the out, if you would take the time to grab one. This provides you with the information that was referred to this evening, the phone number, the new phone number that is available to all of us through public health if we wanted to call and have a question, along with the website of Marin Public Health, along with the website of the Marin County Office of Education. That is a place that you can go to get information about what kinds of strategies are the schools working on if school closes to keep learning happening. And I want you to know that there are distance learning opportunities combined with lower level. Not everybody in our community has access to the internet. So some may say, oh, easy, we'll just use distance learning. The fact of the matter is, in some of our communities, that's not the case. So districts are also working on preparing packets, trying to figure out what are we going to do for the kids in our community who are food insecure. They get their 2 meals a day at a school, right? And so we're also working on that and what the steps will be, and we're continuing to talk all of that through so that, speaking of drive-by, you can get a drive-by test, and you're probably going to be able to get a drive-by box lunch and also a drive-by packet of information. So we're thinking about all of the different ways that we need to be ready to go. We are in constant contact with our partners. Your superintendents and other leaders in your schools are asking as many questions as you've just asked here, trying to make sure that we're fully prepared. And we're also trying to make sure that we're learning from those that are ahead of us. Like you can look at, there's people that are tweeting from Japan. They're closed for many days, right? What are they doing? How are they approaching it? And so I think that's sort of the guidance for all of us, people that are a little ahead. What did you do? What did you learn? What works? What doesn't work? Here's what doesn't work. for a community to say, okay, we're closing all the schools just in case, right? And that, of course, has unbelievable implications at multi-levels in a community, and that actually has happened in some areas in our state, and yet there's other places that you can just watch sort of the steps that they took. So we're trying to make sure every step we take is informed, thoughtful, and always thinking about every single child, so 40,000 of them in our public schools. I also want to assure you that we work and have the same level of communication with our private independent parochial schools. So we're also communicating with them as well. Any last minute comments? We have 1 minute.
Yeah, just, we are having regular interactions. We have a couple conversations a week with school superintendents and school principals. I think one of the things that one of the silver linings around our response to COVID-19 is that it's bringing us together across sectors in even stronger ways. So we're working with our healthcare partners, we're working with our schools, we're working with our elected officials, and it's really galvanizing sort of intersectoral collaboration in ways that will have benefits that last well beyond the end of this particular challenge.
Right. So I just want to make a note. Benita McLaren is here, and Benita is the head of Health and Human Services, so that's who these guys work for. So game on, right? And also welcome Katie Rice, one of the members of our Board of Supervisors. How many total people did we have that were streaming, Kate? Over 1,000. So maybe this is a good example for us that this is the very first time, just for you to know, that we've ever done this. We were thinking, we better try to figure out what we might do, but actually maybe it works. Maybe it works, right? So this is great. So thanks to all of you who are here. I think since clapping is a strong message for this group, let's clap.